Hello, and welcome to our channel. Let us talk about the most important aspect of your health, and by that I mean your cardiovascular health, which has become more prevalent in recent times, making it the leading cause of economic burden over the health sector. But before we dive in depth into our topic, don't forget to subscribe to our channel, and do press the bell icon to get notified of the latest videos we upload every time. We will make sure you have learned these points at the end of this video. Cardiovascular diseases and its types, causes, risks. How do you know about your cardiovascular diseases? Diagnosis. The most prevalent cardiovascular diseases. Ways to improve cardiovascular health. Some of the best exercises to strengthen your heart. Treatment options. How big a burden is cardiovascular disease for developing countries? Cardiovascular system. The cardiovascular system comprises of the heart and blood vessels, and so apart from accepting the fact that the heart is the prime organ here to be discussed for the kind of role it plays in this system, still important to mention is that this also includes the problems of the vessels, be it anywhere in the body, especially in the vessels of the heart, brain, legs, or in the main aorta. Here are given some problems that commonly describe the cardiovascular health. Types of cardiovascular diseases. Coronary heart disease, which means disease of the vessels of the heat stroke, is its another type. That is when there is a compromise of the vessels supplying the brain. Then comes peripheral vascular disease, which is the narrowing of the relatively smaller vessels of the legs. In this disease, the problem is usually the spasm of these vessels due to various reasons. And last but not the least is valvular heart disease, is usually also called as aortic valve disease, because most of the time the involved valve is usually the aortic valve. Remember that aorta is the biggest artery of the body. The causes of the various types of these diseases are discussed here. What are the causes of heart disease? The main vascular issue that is raised in any cardiovascular disease is the narrowing of vessels of the body that may be due to atherosclerosis or due to spasm of the vessel wall. Atherosclerosis means deposition of the fats in the wall of the vessels, followed by the inflammatory changes and leading to the permanent narrowing of the vessels. This fatty deposition is a result of continuous damage of the vessel wall due to high blood pressure, cigarette smoking, and fatty meals. Another most common cause is spasms of the vessels, mainly due to stress, medications, etc. Spasm actually is the contraction of vessels. Cardiovascular disease risk factors. The most important of the risk factors for cardiovascular disease, CVD, is hypertension, also known as high blood pressure. Smoking is a risk factor that has a direct influence on the pathophysiology of cardiovascular diseases. Another important risk factor for cardiovascular disease is tobacco use in any form, including smoking and other tobacco products. That again serves as an irritant for the vessel walls. Cholesterol that is not at the normal level required can pose a direct threat to heart or stroke-related issues. Diabetes mellitus has everything to do with any vessel-related issue because of the disturbance it causes to the metabolism of fats, glucose, and proteins, ultimately leading to the narrowing of vessels due to fat deposition. The sedentary lifestyle has never been the good guy when it comes to a healthy metabolism, and it has the same effect on your heart and vessels as high blood pressure or diabetes mellitus. Obesity comes with a price of fat deposition in the vessels like it does in any other part of your body. The good thing about all these risk factors is that they are modifiable, and all you need to do is to change your lifestyle. But there are two problems related to cardiovascular problems that you cannot do much with, like if you have a family history of this, or if you have an ethnic background for this problem. How does cardiovascular disease affect you? Pain in the chest, chest tightness, chest pressure, and chest discomfort are some of the signs and symptoms that may be present. Angina. Uneasy and shallow breathing if the blood vessels in your legs or arms become restricted. You may experience pain, numbness, weakness, or even coldness in those areas of your body. Palpitation, which is actually the heartbeat becoming noticeable, is a common sign of a weakened heart. All these problems will push you into a sedentary lifestyle that will further add up to this problem of heart-related issues, pushing the patient into a vicious cycle. Diagnosis of cardiovascular diseases. The most important investigation is the simplest one, and that is an electrocardiogram, also known as an ECG, which is usually offered free in most health facilities. This tells you not only about the current, but also about the past health of your heart condition. The other investigations include blood tests, echocardiography, that tells you the power of your heart, and angiography, to find any narrowed vessels in the heart or any other part of your body, mainly brain or heart. The following are the most common cardiac diseases: an attack of the heart, myocardial infarction, more commonly known as a heart attack in which blood vessel of the heart is blocked, is typically at the top of the list of cardiovascular disorders that affect people in the United States. Stroke comes second to myocardial infarction, is where blood supply to a part of the brain is blocked. Arrhythmia, which means irregular heart rhythm, can result in stroke or overburdening the vessels of the heart. Due to increased work, it needs more blood and oxygen, resulting in myocardial infarction. Problems with the heart's valves, like not being able to push the blood only in one direction, lead to a variety of issues, including putting the heart under a lot of extra work to do. How to improve your cardiovascular health? Get moving. Your heart is a muscle, and just like any other muscle in your body, it can be strengthened through exercise. Quit smoking. Putting an end to one's smoking habit is not easy. Get rid of excess fat. Diet and exercise alone are not enough to cause significant weight loss. Consume foods that are good for your heart. Don't neglect to bring the chocolate that boosts up your metabolism. Refrain from overeating. If you are suffering from hypertension or diabetes mellitus, then be careful with your medicines and make regular follow-up visits to your physician. Some important exercises: brisk walking, jogging, swimming, cycling, playing tennis, and jumping rope. When medical professionals recommend at least 150 minutes a week of moderate activity, they have in mind the type of aerobic exercise that gets your heart pumping hard and fast. In other words, 30 minutes of brisk walking 3 to 4 times per week is recommended. Treatment options: increases blood flow, such as those that lower platelet aggregation capacity, or regulates heart rhythm, such as beta blockers, which are commonly used to avoid palpitation or other arrhythmias. Invasive surgical procedures, including coronary artery bypass grafting, valve repair or replacement surgery, and other invasive procedures. It is also important to mention the thrombectomy procedure used nowadays in the advanced setups for ischemic stroke patients. Of all the treatments available for this purpose, the best one is lifestyle changes like daily exercise, adopting a lower caloric diet, rehabilitation for heart conditions, including counseling on healthy lifestyle choices, and exercise prescriptions. This method can save you from the expensive and risky treatment options of medications and surgical intervention. Cardiovascular disease is a huge burden worldwide via human losses and economic growth hindrance. Worldwide, cardiovascular illnesses, often referred to as CVD, are the leading cause of mortality. In 2019, it is expected that cardiovascular diseases will take the lives of 17.9 million individuals, making up a staggering 32% of all deaths worldwide. Though it needs massive awareness, but even the small steps in the right direction are going to end us at a better situation than this. That's all for now. Please let us know in the comment section how your experience with us was and inform us about your precious feedback. If you liked it, don't forget to support us by subscribing to our channel for more videos about your health. Also, do press the bell icon to get notified regarding our latest videos.